Today, we're diving into a small but incredibly important landmark in human anatomy, the sternal angle. We're going to cover what it is, exactly how to find it, and maybe, most importantly, why it's such a crucial guide for any exam of the chest. Let's get started.
So let's start with something you've probably run into. Have you ever been trying to count someone's ribs, maybe in a clinical skills lab, and you just get lost? Yeah, it happens all the time. It's really frustrating. The first rib is tucked away behind the collarbone, and then as you go down, they all start to feel crowded. So, how do you find a reliable place to start? Well, the answer is a simple little bump right on the chest.
So, what exactly is this landmark we're talking about? Let's break it down. The sternal angle, and you'll also hear it called the angle of Lewis, is really just a horizontal ridge that you can feel on the front of your sternum, which is your breastbone. But it's not just a random bump, it marks a very specific joint. This is the exact spot where the top section of the sternum, called the manubrium, connects to the bigger main part, which we call the body of the sternum. It's kind of like the seam where two bones meet.
This image here shows it perfectly. You can see the manubrium up top. It sort of looks like the knot of a necktie, and then right below it is the longer body of the sternum. Well, that line where they join together, the manubriosternal joint, that's our landmark. That's the sternal angle. Seeing it like this really helps lock in where it is.
Knowing what it is, that's one thing, but how do you actually find it on a person? Well, the good news is the process is very straightforward.
Okay, let's walk through it together. First, find that soft U-shaped dip right at the top of your breastbone, at the base of your neck. That's the suprasternal notch. Now, from there, just slide your fingers straight down the middle of the bone for about 2 inches, or 5 centimeters. You should feel your finger go over a very clear bump or ridge, and that's it. Congratulations, you found the sternal angle. And from that exact point, if you just move your finger a little to the left or right, you'll land right on the second rib. It really is that simple.
So now we get to the really important part. Why does this one little bump matter so much?
You see, the sternal angle is so much more than just a feature on the surface. You should think of it as an incredibly reliable map of the thorax. It marks an invisible horizontal plane that slices right through the chest. And at that exact level, a whole bunch of critical things are happening and key structures are found. It's like a major highway intersection for the body.
So, first off, its most practical use, like we said, is counting ribs. The second rib always attaches at the sternal angle, which gives you a guaranteed starting point. From there, you can just count down. But it's a deep landmark too. This same flat plane lines up perfectly with the disc between the T4 and T5 vertebrae in your back. And, super importantly, it divides the mediastinum, that's the central space in your chest, into its upper and lower parts.
Now, let's talk about the great vessels. This is where it gets really fascinating. The aorta, the body's biggest artery, makes its famous arch right at the level of the sternal angle. The part coming up from the heart ends here, the arch happens here, and the part going down to the body begins here, all on this one plane. And just a little bit below it, the pulmonary trunk splits into the left and right pulmonary arteries. I mean, the heart's main plumbing is just perfectly organized right around this landmark.
And it's not just the plumbing. This also shows how important it is for the airway and the heart itself. At this level, your trachea, your windpipe, splits into the 2 main bronchi that lead to each lung. This landmark also tells you where the top of the heart's base is, and it's where you'll find the cardiac plexuses. That's the complex web of nerves that controls your heart. It is just an incredibly busy and vital anatomical neighborhood.
Okay, I know that was a lot of information. So for anyone studying for exams, this next part is for you. Let's boil all of that down to the absolute must-know facts.
So here's the deal. You need to connect the sternal angle to these 5 key events. If you remember nothing else, remember these. 1. It's where the second rib attaches. 2. It's where the aortic arch starts and ends. 3. It's where the trachea divides. 4. It's the line that separates the superior and inferior mediastinum. And 5. It marks the upper limit of the base of the heart. These are the high-yield facts that will really help you out.
All right, let's just wrap this up with one final, simple thought to take away with you.
So, the next time you feel that small ridge on the sternum, remember what lies beneath it. It's a precise, dependable guide to all the vital structures of the thorax. If you can master this landmark, you really master the map of the chest.